Good morning. It is Thursday, October 2nd. I'm Michelle Dials, and you're listening to Talk of the Town on 1230 WSAL. Joining me this morning from Logansport Memorial Hospital, Vicki Bird is here. Good morning.
Good morning, Michelle. How are you?
I'm good. How are you?
Fine, thank you.
And this has kind of become an annual event for us. Normally, you guys are here on the first Wednesday of the month, but we changed that to the first Thursday in October so we can do a full hour. And October is Breast Cancer Awareness Month, so that's why you guys are here today.
That's right, and we have several guests with us today to so that we can really celebrate Breast Cancer Awareness Month and share some stories about folks that have or had breast cancer.
Okay, and we have Dr. Todd Weinstein with us. Good morning.
Good morning. Thanks for having us.
Absolutely. And then the ladies that are with us this morning, you guys are kind of celebrities around town. People have probably seen your pictures around town, but we'll go ahead and introduce each of you. And Andy, because you didn't want to go first, I'm going to make you go first. Go ahead and just introduce yourself.
Andy Nichols.
Cheryl Martin.
Sue Richardson.
Okay, and welcome, ladies, and we'll be talking more with you a little later in the program. We're going to kind of kick things off with Dr. Weinstein, but go ahead and tell us a little bit about yourself and your background.
Well, my name's Todd Weinstein. I'm a general surgeon here in Logansport. I've been here for 23 plus years now. Came out of an IU residency program in Indianapolis where I'd been the 5 years before I moved to Logansport. Grew up in Pennsylvania, went to college and medical school down in Florida. But I've been here 23 years now. I'm one of the three general surgeons here in Logansport. Dr. Mike Lalla and Dr. Gerhard Winkle are in practice with me. The three of us and also Dr. Jim Hall from Women's Health Center, all four do breast care here in Logansport.
Okay, so a general surgeon, what's that all about?
General surgery is a subspecialty of surgery in which people do a variety of different kinds of surgery, and breast surgery is one of those things we do. We also do abdominal surgery, hernias, gallbladders, stomachs, colons. We do skin surgery, but breast surgery is a significant component of what we do.
Okay, and it is Breast Cancer Awareness Month, so obviously we're going to be talking about breast cancer today. Can you give us some statistics about that disease?
Well, yeah, breast cancer is the most common cancer amongst United States women other than skin cancer. When we do the statistics, frequently we kind of leave skin cancer out because it's sort of a different case. But breast cancer is the most common kind. The chances of an American woman getting breast cancer at some point during her life is about 1 in 8. There's about 300,000 women a year diagnosed with breast cancer, about 230,000 of those with invasive breast cancer. The chances of a woman dying of breast cancer is probably 1 in 36. There'll be about 40,000 women in the United States this year die of breast cancer, unfortunately. The good news, though, is that breast cancer death rates have been dropping for about a quarter century. Ever since 1989 is when we kind of saw that turnaround happen. And right now there's almost 3 million, over 2.9 million American women living with breast cancer, survivors of breast cancer. And so the news is getting better.
That is good news. What do you think caused that turnaround? Yeah.
I think it's a combination of probably 3 different factors. One factor is improved treatment. The medicines have gotten better, the surgery has gotten better, the way they do radiation therapy, the radiation therapy machines have gotten better. I think a lot of the techniques are better and lead to better survival, and then also lead to less side effects. I think a lot of people are a little trepidatious, a little worried about chemotherapy or radiation therapy because their grandma had such a bad experience, but it's not. It's a lot better nowadays. The techniques and the machines have gotten a lot better. So one thing is improved treatment. A second thing is improved screening. With breast cancer screening, we can find women at an earlier stage in the disease, and the earlier stage you're diagnosed at, the better your survival rates are. If you're diagnosed with stage 0 or stage 1 disease, the earliest stages disease, you have essentially 100% survival. Even if you're stage 2, you have probably a 93% survival. So obviously what we try to do is screen people and find people early, whether they're stage 0, 1, 2, because the survival rates there are still pretty good. If you're stage 3, the survival rates are now dropping into the 70s. If If you're stage 4, now we're talking survival rates of about 22%. So obviously that's why the screening is so important.
And the stages refer to how advanced.
The stages refer to how advanced it is. There's a couple of factors that come into play when we decide what stage somebody is. The most important things, we talk about TNM staging, tumor, nodes, metastases. The most important factors are how big the tumor is and whether or not the tumor is growing into the skin or the muscles or anything. The lymph nodes in the armpit and near the collarbone, and then whether or not it is spread anywhere like the liver or the lungs or something like that. And that's how we determine what stage it is.
Okay. I want to get back to screening in a minute and some of the testing that's available, but I want to switch over to you guys for a second and go ahead and give you an opportunity to kind of share your story with the community. Like we said, you guys are on billboards all over the community, so people have probably seen your pictures, but now they're going to have a chance to hear from 3 local breast cancer survivors. So, Andy, can we start with you?
Yes. My story started at my first prenatal exam. I'm currently 36 weeks pregnant, and Dr. McClintock found a lump in my left breast at my first OB workup when I was about 12 weeks along.
So, can I ask you how old you are?
I'm 34. I was 33 at the time.
Okay. And is that fairly young for breast cancer?
That is fairly young. It is not unheard of, but it is fairly young.
So walk us through, I guess, what happens then, because obviously being pregnant, your treatment plan is going to be a little different.
It was slightly different. I couldn't have MRIs or CAT scans. So once we did a core needle biopsy and found out that it was cancer and didn't know much else at the time. Then I had a ultrasound on like my liver, kidneys. I had a chest x-ray, and I had a lumpectomy with lymph node removal as well, and all of those were negative. I did come back as a positive for the BRCA gene, so I am a carrier there. So there's quite the family history based on that. And so I started chemo after my lumpectomy, and I was well into my second trimester, which is what they were waiting for. And I had 4 rounds of chemo, and then we stopped, and we're waiting for the baby to be born, and then I will start chemo again 2 weeks after.
Wow. That's a gut-wrenching story. I mean, it really is. Now, I want to go back to a question for you. She mentioned the BRCA gene. Does that have to do with BRCA testing?
It does.
Okay.
It does.
Can you explain what that is?
Sure. If you look at people who have breast cancer, a certain proportion of those people, that breast cancer is linked to a specific gene mutation. And it is called a BRCA, which stands for breast cancer, BR breast CA cancer, breast cancer. So, and there's 2 genes that have been identified, BRCA1 and BRCA2, and they've specifically identified these genes. It's on, the 1 is on chromosome 17 and 2 is on chromosome 13, and they can specifically tell you exactly what's going wrong with them. And the thing is that if you have one of these mutations, your chances of having breast cancer or ovarian cancer dramatically go up. If you have a mutation in those genes, you probably have somewhere between a 50 and an 80% chance of getting breast cancer at some point in your life. Maybe about a 20 to 40% chance of getting ovarian cancer. And so and men can get these genes too. And if men get those genes, they're at risk for breast cancer. People don't think of men as getting breast cancer, but about 1% of breast cancer cases are actually in men. And men are at risk for breast cancer and prostate cancer. So usually if somebody has a breast cancer and there's some reason to think that they're at risk for having a genetic mutation, either there's a strong family history, multiple family members have had cancer, a person who gets breast cancer at a young age, such as Andy, or maybe somebody who has what's called triple negative disease, which has to do with how the pathology report looks. You might think they're at risk for breast cancer if breast cancer gene mutation. So if they have that, then you do this testing, And fortunately, the testing is getting to be more widespread and easier to do. I think maybe a year and a half ago, the United States Supreme Court actually said that this testing has to be made more available. So that's made things a lot easier. And so you do this testing, and then if somebody has it, then you go ahead and test their family members. And if their family members turn out to have this gene mutation, then you can provide counseling in terms of what they can do to try to improve their odds of success. So it's great, if you do the testing on the family members, it's great. For, if you find that they have it, you can help them. If you find that they don't have this gene, then they can quit worrying about it. So the testing has helped a lot.
Okay. I think we could probably have booked like a 3-hour show today. Vicki, I think there's enough to talk about. But Cheryl, let's hear your story.
I was scheduled for a routine mammogram for my yearly checkup and had that, and my physician felt that we needed to do some further testing. I had a physical exam and then an ultrasound, which did confirm the mass. And so then I too had the core needle biopsy, and that confirmed malignancy, estrogen receptive. And so then things started happening very quickly. I was referred to Dr. Hall then, and further testing with the
there's a whole new
I forget what it's
vocabulary.
called. The MRI.
the MRI.
Yes, the bilateral MRI. And then surgery was scheduled, and I had a left breast mastectomy and lymph node removal. And after that, I then met with the oncologists that are here. Dr. Marvel is radiation oncologist, and Dr. Harwood was my chemotherapy oncologist. From there, we developed the treatment plan, and so I had chemo, radiation, and now hormone therapy.
So how long ago was this for you?
My diagnosis was April 30th of 2013.
Okay.
So.
Thank you for sharing that story with us. And Sue, what about you?
Well, I was very fortunate. Dr. Weinstein did my surgery, but my mother died many years ago, but she had breast cancer when she was 35 and did survive that for 24 years. I had a first cousin that had breast cancer and did not survive. I had an aunt that had it, so it was very prominent in my family. So I was very good about getting my routine mammograms. I had several biopsies, which were all negative. This one was, thank goodness, the non-invasive type, which so I feel very fortunate in that. I did not have to have chemo. I just had the, I suppose they call it a lumpectomy type thing, and did have radiation afterwards. And this has been 2.5 years ago, and so far so good, and I keep having my mammograms when I'm supposed to.
And let's talk a little bit about that, Dr. Weinstein, about, I mean, I think the ladies that are here with us today are a testimony about why screening mammograms are so important, but from a physician's perspective, can you kind of talk about that?
Absolutely. Screening mammograms are important because, like we talked about a minute ago, the earlier stage you're diagnosed at, the better your survival rates are. Sue, for instance, when she said she was in situ, that means her survival rates are right around 100%, and that's very important. So that's why we recommend screening mammography. Most of the statistics will show you that by doing screening mammography programs, you can decrease breast cancer mortality by about 15 or 20%, which if you think about that 300,000 women a year we were talking about, that's a large number of women. There's actually been some studies that even indicate that in women in their 40s, there was a study out of Sweden recently that said in women in their 40s, a breast cancer screening program will decrease mortality by maybe 29%. So I think it's a very important program.
And when should those screenings start?
There's a little bit of controversy in the United States about this. I believe what the American Cancer Society says, which is you start at age 40. And then when you stop, I think is a little controversial. If you look at the United States Preventive Task Force, they say stop at 75. I'm not quite so sure 75 is the right answer. I think it depends a little bit upon the health of the woman. But I might go.
was older.
Yeah, I personally think you start at 40, and you keep going pretty much as long as the woman's healthy.
Mm-hmm. Okay. Now, they touched a little bit on each of their treatment plans. I'm assuming the treatment plan has some similarities for people, but is also very unique to the individual's particular case.
Absolutely. Every treatment plan is very unique. And you're talking about 3 women with 3 different situations who obviously ended up with 3 very different treatment plans. Getting breast cancer while pregnant obviously gives you an entirely different treatment plan. And then an invasive cancer gets you a different treatment plan than a non-invasive cancer. And so treatment plans have to be individualized to every patient. And that's why, here in Logansport, we actually have a tumor board conference, and we meet regularly. The primary care physicians, the woman's own doctor comes to the conference, the surgeons come, the radiation oncologist, Dr. Marvel, usually comes. The medical oncologist, Dr. Harwood, or his partners, Dr. Mulheron and Dr. Miller, come, and everybody sits down in one room around a table and discusses each patient and determines what the best treatment plan for that patient is, what kind of surgery, radiation, whether or not and what kind, chemotherapy, whether or not and what kind, and you get the entire team together and formulate a treatment plan based for that individual patient.
And obviously, you guys as patients are very involved in that because there's a whole new vocabulary that comes along with hearing the words "you have cancer," and I mean, all of you know exactly what you've been through and that sort of thing. So can you kind of touch a little bit on after the diagnosis and going into the treatment plan, kind of the relationship with your doctors? I threw you off with that question, didn't I? It wasn't on the script.
I'll start because I've got to leave in a few minutes. I'm a nurse, and I've worked at the hospital for 40-some years. So I've known Dr. Weinstein since he came 23 and more years ago, he said. But naturally, I didn't like the word cancer, but I was very relieved when he told me, well, if you have to have it, you have the good kind, the non-invasive kind. So it really relieved my mind because I knew what he was talking about. I'm sure that it would be very difficult for maybe just a layperson to realize how important that is because the survival rate is so much more. And I had an option of doing a mastectomy or a lumpectomy, and I chose the lumpectomy, which, is neither here nor there really. But you've got to have a good rapport with your doctor because you're going to fall apart. There's no doubt about that.
Anything the two of you want to add to that?
I would just agree with that. The initial reaction is shock and fear. But I just felt completely surrounded with compassion, friendliness, understanding. Every person that I met, all of my doctors, all of the support staff could not have been any better as far as I was concerned.
Yeah, I would agree. I know the Women's Health Center has been great to me. I walk in now and everybody knows who I am. I don't have to check in. They're just like, oh, you're back again today. Dr. McClintock and Dr. Hall really took care of me because I fell apart. I was there for a completely different reason, being 33 and not even being anywhere near mammogram age, to walk out a couple weeks later knowing that I had breast cancer was completely different. So I really needed a lot of support and guidance in that area.
All right, we'll take a quick break. We'll be back with more Talk of the Town.
America's best music.
12:30 a.m. WSAL.
Good morning. We are back with Talk of the Town. I'm Michelle Dials, and joining me this morning from Logansport Memorial Hospital, we have a full house. We've been talking with them for the first half of the program. And Vicki, I was just thinking I'll try to get that rain out of the forecast for you for Saturday because I know you guys have a big event coming up that we'll talk about a little bit later in the program. But okay. All right. We are talking this morning with Dr. Todd Weinstein and some of the local survivors of breast cancer who are featured this year by Logansport Memorial Hospital. We have Andy Nichols, Cheryl Martin, and Sue Richardson. And good morning to you guys again.
Good morning.
Sue, I know you have to head out here in a few minutes, so I want to start with you. And we talked about your story, but I want to kind of talk about what advice would you give to other people who've been recently diagnosed with breast cancer or with any type of cancer?
Well, that's a hard question because, like I said before, you've got to have a really good support system, and you've got to trust your physician. And if you don't feel comfortable with that, then I would say you better get a second opinion, because if you don't feel comfortable and trust the doctor, you're not going to have a good experience. More than likely, you're going to have some difficulties, and I think Dr. Weinstein would agree with that.
Absolutely.
Excuse me, that you definitely want to have that rapport. You need a lot of family support, and also a lot of community support when you get down to it. And your church family, I think, is also a very good place to start. It's very frightening, and I was unfortunate when I had mine that my husband was also fighting lung cancer. So it was double hard
Absolutely.
for us.
Absolutely. Thank you for sharing your story with us this morning. Cheryl, what about you?
Well, I would say that once the initial shock and is not so overwhelming, as you see that you have people around you that are going to be very supportive, is to find a way to be positive. Staying positive through the whole journey is very, very important, and for me that was my faith. And the outpouring of love and caring from family, friends, and other survivors. At first, I focused on how many women died from this, and I thought, why am I doing that? I need to be focusing on all the ones that have survived and why they've survived. And so I was able to do that. And at first I thought, I can't have cancer because I have 3 little grandsons that need me, till they're old enough to be on their own. And I was able to work through that. And then the other thing that, besides a positive attitude, is being grateful for what they do have here in the way of doctors, all the services that are provided through the hospital here and the cancer center. I never once questioned, do I need to go somewhere else? I did have that complete faith in my doctors. And even though some of my family members that are not from here felt I should do something else, I had that confidence the whole time. So,
Very good. Andy?
I would agree. Just the initial shock is terrible to get through at first. And I know I found out on a Thursday, and we didn't really have a plan until Tuesday, which was really trying to go through those days and just think, okay, I'm walking around with cancer and we're not doing anything about it. But then once we hit the ground running on Tuesday, it was smooth sailing from there. They had a plan. I completely trusted them. My doctors, Dr. Hall and Dr. McClintock, we tested everything, and I kind of went in it with whatever you need to do, whatever we're taking out, putting on, whatever it is, just let's make it go away. Let's just make it go away. But I agree, like the support around from my family, my friends, the community, just people in general that have reached out and said, we can get through this. I think it's very easy to fall into the worst case scenario and look at the statistics and think, oh, okay, great, I have cancer, and how many people have died from cancer. But now the treatment has been so advanced, and it just, you have such a better perspective on it. That
I just would like to add, it truly is a journey, and each step is a new experience. But I think that if you do face it in a positive way and believe in your caregivers and what they're doing, that you become a stronger person and that you can handle just about anything because of what you have experienced through that journey, and it becomes a positive thing.
I also want to add that being 75 and quitting mammograms, I would not agree with, since I was over that when I had my mammogram, and if I hadn't had it, I don't know what would have happened.
And I will say that I was nowhere near 40 to start mammograms, and this was my first mammogram, so I think 40 might be, with a family history, definitely might be a little late.
Now, both of you, Sue and Andy, you said that you had a family history. What about you, Cheryl?
Yes. In fact, right now I have 2 nieces younger than me, and both have breast cancer.
Wow.
One metastasized. I did have the BRCA analysis, and we are all negative. They've had it too. So.
Sue, I know you have to head out, but thank you so much for joining us this morning.
You're welcome.
And Dr. Weinstein, you gave us some statistics at the beginning about the chances that people have of dying from breast cancer.
Yes, ma'am.
Can we go back to that for a minute? What was the chance of dying from breast cancer?
Well, it depends obviously on what stage
Okay.
cancer you have.
The chance, you had a statistic about the chance being 1 in 36. Is that
Yeah.
just a one of
If
36 women, or
1 in 36 women in the United States will end up dying of breast cancer.
okay? And so if we flip that,
Mhm.
35 of 36 will be survivors.
Exactly. I mean, the survival rate, the majority of women with breast cancer will survive. Even the majority of women with stage 3 breast cancer will survive. And the survival rates have been getting better for a quarter of a century now. So, it's a horrible thing. I don't want in any way say that breast cancer is not a bad thing. It's a serious thing, and it needs to be taken seriously. And yet there is a lot of good news out there.
Well, and I think speaking to what both of you said about being positive about things, I mean, just the way that you look at something, you can sit there and think, okay, 1 in 36 will die, but you can also think 35 of 36 won't. So it's just in how you look at the journey that you're on.
Absolutely. And we didn't know these statistics when we were diagnosed.
Right.
I mean, it comes as a shock, and so initially you just feel really bad about it, but as he says, it turns into a positive thing.
Let's talk a little bit about the resources that are available to people to fight cancer here locally. I mean, they've touched on it, but let's run through those again a little bit.
Sure. As I said, there are a number of different surgeons here in Logansport who are experts on breast cancer. In my office, there's myself and my 2 partners I mentioned earlier, Dr. Winkle and Dr. Lala. Dr. Jim Hall at Women's Health Center is also an expert on breast cancer, actually has been published in terms of breast cancer. And so we're very fortunate in terms of having a strong core of good surgeons who can work with that. The primary care physicians here are all excellent in terms of taking care of breast cancer and helping women get the appropriate screening at the appropriate times. We have the medical oncologists. Their main office is at St. Vincent, but 3 days a week, the medical oncologists are here in town. Dr. Ray Harwood, Dr. Janelle Miller, and Dr. Brian Mulheron. And they are terrific. I mean, I don't think you could find a better medical oncology group than those 3. And then we have the radiation group here in town. Dr. John Marvel is the one who's here most of the time. His partners come in and cover for him part of the time. Again, just an excellent, terrific, top-notch group. We have radiologists on site. There are some places where people go get mammograms and there are not radiologists on site. We're fortunate that we have radiologists right here on site to look at the mammograms immediately, make sure the pictures are exactly what they need to be. We have the availability of MRI. We have the availability of ultrasound. We can do ultrasound-guided biopsies. We can do X-ray guided biopsies. So there's just an awful lot available here in town to help people through this process.
Okay. As far as screenings, Vicki, I know we've talked about this before, but there are some opportunities for people to obtain free screenings if this is something that's not available to them otherwise.
Right. The Hospital Foundation, actually for the last 4 years, has participated in a grant, and it's through the Indiana Breast Cancer Trust Fund, which if you see the license plates and you see the breast cancer sign on those, that's what actually funds that foundation. And so every year we apply for some resources to have money to do free screenings. We offer those to women that are uninsured, underinsured, / low income women. So, and we actually still have screens available for this funding cycle, which ends the end of December. So, with it being Breast Cancer Awareness Month, that's when we really kind of start to see an increase in the number of women coming to the hospital for screens. But I would encourage anyone who, you know, is in need of a screen and doesn't feel like they have the resources to pay for it to call the hospital. You just call registration and they'll walk you through that process to see if you would be able to use one of those screens for your mammogram. In addition, the Hospital Foundation also has a small set of funds set aside that if a woman happens to test and they need the next screen after their just initial mammo screen, that we can help assist with that as well. So we do have availability for folks that may not have the resources to cover that through insurance or other means.
Okay, so just give the hospital a call
Yep.
and get more information
Yeah.
about that.
Yeah.
Okay. Dr. Weinstein, any advice that you have to the women of our community with respect to the things that we've been discussing today?
Well, I guess I would make 3 main points. And one point, we've talked a lot about screening mammography. And screening mammography is very important, doing the appropriate screening, which usually is mammograms. MRI has a role for certain women, women who have one of these BRCA genes, for instance, women with a very strong family history, women who had radiation to their chest wall before age 30 for some reason. Probably MRIs have a role. Ultrasound has a role in it, but make sure you get your appropriate screening. I think that's very important. As we've said, that can decrease your chances of dying from breast cancer by probably 15 to 20%. That's one thing. The second thing, and we talked a lot about the screening, finding the breast cancers that aren't visible, aren't able to be felt. But it's also very important if you notice something wrong with your breast, if you have a lump, if you have redness or tenderness, if you have discharge from your nipple or just some sort of change in your nipple, don't ignore it. Don't think, oh gosh, this is probably nothing. And I unfortunately have talked to a lot of people over the years who said, well, gosh, I thought maybe there was something wrong, but I just didn't want to go see a doctor because I just was afraid what they would tell me. Well, don't do that. Come as early as you can. As soon as you notice something, as soon as you notice a lump or anything like that, come in and let us evaluate it and let us get on the road to fixing it. One of 2 things will happen. Either it is something bad and then we can get on the road to fixing it, or it's not something bad and then we can tell you to quit worrying about it. And either way, it's better than ignoring it. So that's the second thing I would tell you. The third thing I would point out, there's a lot of these factors we've talked about: family history, having the BRCA gene, risk factors for breast cancer that really are not anything you can control. But there are risk factors for breast cancer that you can control. And probably the 4 I would mention, and it's stuff that in general is just good for your health overall, but it has been shown to affect breast cancer. Number 1, maintain a healthy weight. Number 2, exercise regularly. There have been studies that show people who exercise regularly kind of changes the hormones in the body, and it decreases the chance of breast cancer. There have been studies that have shown that maybe 1/3 of the breast cancer cases are attributable either to obesity or to lack of exercise. So maintain a healthy weight, exercise regularly. When you get to menopausal age, use hormone replacement therapy in a rational fashion. Kind of use it for as short a period of time as is possible for you. And then limit your alcohol intake. Probably no more than 1 drink a day would be the appropriate alcohol intake. And if you do those things you can control, you can actually decrease your chances of getting breast cancer.
Now, we focused a lot on women today, but you mentioned at the beginning of the program that breast cancer can affect men as well. And so can we touch on that just a little bit again? I mean, are the symptoms and that sort of thing similar for men?
They are. There's about 2,300 men a year get breast cancer in the United States, which obviously is only about 1% the number of women, but still, it's a significant number of people. Usually with men, obviously men don't get screening because it's such an uncommon disease in men. So usually in men, it's a lump under the breast. A man feels a hard lump under his nipple, sometimes discharged from the nipple, but usually it's a matter of feeling a hard lump. And it's just important for men to know that although rare, it is possible for a man to get breast cancer. And so if you do have a lump in your breast, you should get that checked out.
Okay. Cheryl and Andy, as we wrap up this morning, is there anything we haven't talked about this morning that you guys would like to share with people or make sure people are aware of as we wrap up our time together this morning?
Mine is just to repeat what we've been hearing this whole time, that early detection is the best thing, and so you need to get the mammogram.
Yeah, I would echo that, and along with that, just the self-breast exams are, I was, again, nowhere near mammogram age, and I've now officially had a couple. So, but just monitoring your own health to make sure there's nothing there is probably what's best.
Okay. Well, thank you guys so much for coming in and sharing your story with us this morning.
Well, thank you.
Vicki, let's talk a little bit about the River Bluff Run that's coming up on Saturday.
It's Saturday, October the
11th. I'm sorry. Yes,
it's a week from this Saturday.
Yes,
and,
I'm sorry.
You did promise good weather.
Okay, so I'll keep the rain out for next Saturday.
Yeah. We have the run. This run really promotes breast cancer awareness, and the registration starts at 7:30. The run starts at 9 o'clock, followed by a walk. So if you have not registered to participate, you can call the Hospital Foundation office at 753-1595 to get registered. We encourage teams of folks to participate, and there's actually a reduced registration fee if you have a team of 5 or more. It's $15 per person, and early registration will run through next Friday, October the 10th. So please come out. It's always a great time. We have music. We also then do a short program between the walk and the run featuring our breast cancer survivors, and have one of our physicians talk about breast cancer. So it's encouraging to the folks that are there. It's a nice morning.
A lot of pink, right?
A lot of pink, yes, a lot of pink.
Okay. So again, Saturday, October 11th.
Right.
All right. I apologize for that. I had an initial deadline in my head, and so that was what threw me off. But you guys will accept that reduced.
Through next Friday.
Right. Okay. Dr. Weinstein, anything else from you before we wrap up this morning that maybe we haven't touched on today? Any final thoughts from you?
Again, I think it's just important for women to remember the things we've been talking about. I think. Number one, if you have any suspicion, if you have any concerns, get it checked out, do the appropriate screening, and do the things that we just talked about that'll decrease your risks.
Okay. Anything else from any of the rest of you? Vicki, do you have anything else you want to add?
No, just thank you for having us. It's so inspiring to hear everyone's stories, and I'm always amazed when we do any talk of the town and walk away with all the information and knowledge that the physicians share with us. I mean, we have just great physicians at our hospital, and I think, Cheryl, you said there's really no need to go out of town. And that's true. I mean, we've talked about that so many times, and our resources here are just as great as any place else.
Well, and I mean, this is something where you have a lot of appointments, I would imagine.
Right.
And
Yes.
I mean, you're a mother and you've got a pretty full schedule
Yes.
to be battling cancer on top of it. I mean, for anybody, that's a lot to take on. So the fact that it is available here locally is a phenomenal resource.
Absolutely.
agree.
I've left town for a doctor's appointment once in the last 6 months, and that was just a consult that took 10 minutes.
That's a good thing. That's a good thing to hear. I mean, and that's kind of part of why we do this, is to showcase to people what is available to them locally.
Absolutely.
All right. Well, thank you guys so much for coming in this morning.
Thank you.
Thank you.
That'll do it for us for Talk of the Town for today. We'll be back tomorrow with more.